Is there an increase in the budget for midwifery this year, and are services being expanded in this budget?
The budget this year is expected to be, or is, 820,000, which is similar to the 22-23 budget.
Thank you to the Minister through the Chair. And are midwifery services being expanded in this budget? Thank you.
Thank you very much, through you, Chair. Certainly, we've had a third-party, independent third-party do an evaluation of the site, the demonstration site here in Fredericton, and that work has been completed. So that'll enable the department and the shareholders to make some decisions based on the evidence, based on the results. And based on that information, that'll develop the next steps in the services in the province, and our expectation is by the summer of 2023 we'll have those next steps available, or we'll roll that out in some manner or form.
Minister, thank you to the Minister through the Chair. So this pilot project started in October 2017. The evaluation was done last year. It's taking an awfully long time to expand these services that are needed across the province. And it's quite frustrating for all of the people who would like to access midwifery services in different places in the province. I don't think I will get much more information on that. So I'm going to move on because my time is limited. I'm wondering, on the topic of trans healthcare, is there money in the budget for people to be able to have top surgery? Thank you.
So we were discussing the terminology used, and I didn't hear it correctly, so I just confirming with staff that I heard correctly. And certainly there's a number of initiatives there, whether it's medications provided in hospital, are entitled services, and again, some of those prescriptions are part of are available through the New Brunswick drug plan if somebody doesn't have a drug plan, and specifically when it comes to sex reassignment surgery, female to male is covered, and that was the answer there. The budget is, I guess, primary care pathways for concerns related to youth, marginalizing populations who are at greater risk, and part of that whole service is, again, through the sexual health service. So there's part that's under surgery, but also there's sexual health surgeries that are available as well.
Thank you, through the Chair, to the Minister. And so in terms of these gender-confirming surgeries, is breast augmentation covered for trans feminine patients?
Thank you very much. Again, just confirming that the hormonal part of enlargements are covered, but the surgical augmentations are not.
Thank you to the Minister through the Chair. So it sounds like top surgery is covered for trans men, but not fully for trans women. Is that correct?
Right, and I will add to that affirmation that the new standards of practice are being reviewed, and again, as this situation evolves, we want to evolve with it, and that's why we are evaluating the new standards of practice.
Thank you to the minister through the chair. How quickly are these standards being evaluated? I guess how quickly would people have access to this service? And I want to explain to the minister through the chair, people requiring this surgery, fundraise for it. New Brunswickers, fundraise to get this surgery. That is not acceptable. So how quickly will they be able to stop having to fundraise, selling art, selling things, to get medical care? Thank you.
Thank you very much, Mr. Speaker, and you know, this is an interesting discussion. I appreciate the member bringing it up, and as I mentioned, it is new territory as we make decisions going forward. And I know some of that debate, if someone asks for a particular surgery to be covered through Medicare and they are refused, there is an appeal process. Now, just because someone appeals doesn't mean they would be granted that, but you know, in the absence right now of the final decision on some of that new standard area, we need to you know, again, give people the option if they want to appeal, and then based again on the committee, there's an independent committee, the Medical Appeals Board, that may overturn some of the decision made on Medicare, which again have a list of approved and not approved procedures.
Thank you to the minister through the chair. That's a whole lot of burden to put on patients to have to appeal for their gender-confirming surgery. And in some provinces it is covered. And so this is a choice New Brunswick has made so far. I would urge the minister to move this forward as quickly as possible. This is very important. And frankly, not having access to gender-confirming surgery can be very harmful to the mental health of someone who is trans. And they have, people who are trans experience higher levels of mental health issues because of things like this, because of things like having to appeal to get health care. So I'm going to move on, but I'm actually going to go back because I want to go back to midwifery. I know I don't have that much time, but I think this is important. Perinatal health care is an afterthought in New Brunswick. I don't understand why we can't improve it. Our rates, whether we look at C-sections or breastfeeding or maternal mental health, all of these things, like, we're not doing well. But we could do better. Again, these are choices that are made in budgets. So when will the people who give birth and are pregnant, and frankly, we could expand the scope of practice for midwives, and they could provide sexual health care as well. When will the people who give birth in this province have access to midwifery care?
Thank you very much, Mr. Speaker, through you to the member opposite. Just a little more information. Since October 17, and again, some of the folks at home might be interested to hear this or following online, there have been over 502 families in midwifery care in the Fredericton area, and 409 midwifery assisted births, 300 in the hospital, interesting, and 109 at home. So again, an evaluation of this demonstration site was completed, and was completed by an independent third party, and that information is again going to make evidence-based decision, and we plan to have the next step on that file moving forward. And again, part of that evaluation will include the training and the access and you know, the outcomes of those families that have chosen to go there. But again, from an idea that you know, again, where we recruit various aspects, whether it's physicians, NPs, LPNs, RNs, you know, there's a shortage of various healthcare providers right across, you know, not just Moncton or not just New Brunswick, but this is one area where, again, we'll need to do the work, and once that work is done and the decision's made, we'll be informing the public. And our target is summer of 2023. So I appreciate the patience that people have had, and again, asking for some more patience while the work is done, and the right steps are based on the evidence that we have will be rolled out.
So I guess I'd like to know when we're going to have midwifery care, when we're going to have better perinatal care available in different places. They could serve rural areas and places where people actually don't have access to some of the care that they need. And the report, the evaluation was last year, so I guess I don't know if haven't had time to look at it and move this forward. It's clearly not a priority. It is for me. So I would like to know, through you, Mr. Chair, to the minister, what is the plan to ensure that mental health care is covered for people in New Brunswick? Many people pay out of pocket. Are there negotiations in place or in process? Is there something coming down the line where people will receive free mental health care? Thank you.
Thank you very much, Mr. Speaker. And there was sort of two questions there, or there was a comment, and then the member moved on to another topic. So I want to make sure I just again frame up some of the considerations for expanding the midwifery here in the province of New Brunswick. And again, part of it is based on, you know, what does the population need, and you know, what is the ability to recruit to some of the rural areas, because the member said, you know, across the province of New Brunswick. And again, we have urban centers, we have rural centers, and even when you look at some of the other specialties, you know, it's not available through the whole province. But, you know, whether it's oncology or heart or some of the gastrointestinal, you know, there are specific centers that you need to travel to in order to get those services. But again, looking at what are the needs of the population, what is the capacity to fulfill some of those needs, and again, some of those practicing standards, how will they be met? And are they sustainable as you set up a practice, or are there just not enough people that would want to use that type of services to keep that sustainable? And again, the way we've worked with some of the clinics that are set up, there needs to be arrangements with the RHAs, and the RHAs are responsible for some of that operational, day-to-day operational, which also requires some official language capabilities and bilingual services. So those are some of the things that need to be evaluated as it moves forward. So I know, once again, the member opposite seems frustrated, but we're trying to, again, ask for that patience to make sure that the right decisions are made. Now, the next on mental health and addictions, which is a very, very important aspect of the care here in the province of New Brunswick, and it is certainly something that is important to me, and something that I've wanted to understand fully how we are managing that. And I guess the comment about when will it be available to everyone at no cost? Well, there's a significant amount of general mental health services that are available that are paid for by the province of New Brunswick. And actually, when you look at the budget has increased by about $18 million here in, 18,000. Is that in thousands or is that? Yeah, millions. Yeah, that's in millions. I thought it was. So it's overall $162,884,000. And I'll just run down some of the community mental health services that are offered across the province. We have 16 community addiction and mental health centres. Now, some are satellites and outreach offices that ensure the provincial access to care. So when you look at the map of the province, it's across the province. Services available range from screening for addiction and mental health related issues, assessment, interventions such as the one-at-a-time therapy. One-at-a-time therapy has been one of the most successful initiatives that this government has brought forward, because it has reduced the number of people waiting for an intervention by a substantial amount. We talk about wait times, wait lines. Well, this one-at-a-time therapy has dramatically decreased the wait time. These 16 community addiction and mental health centres also provide individual counselling, educational group sessions, and more intensive services such as mobile crisis service and the flexible assessment community treatment, known by the acronym FACT. These services are offered and operated by the two regional health authorities, the Vitality Health Work and the Horizon Network. So again, maybe in understanding the question, these are the services provided by government when it comes to mental health and addictions. And the province has a total of 8 psychiatric units that operate under the regional health authorities. In addition to these psychiatric units within the general hospitals, 2 specialized psychiatric hospitals also offer treatment in New Brunswick. That's the Restigouche Hospital Centre in Camelton, which includes 20 beds for forensic assessment, and a variety of community partners that also receive funding from the Department of Health to offer services and focus on awareness, education, support, and counselling within the community. So maybe I didn't fully understand the question, but from a standpoint of what are we as a government doing for mental health and addictions here in the province of New Brunswick, I guess I could expand that also to look at some of the treatments or some of the symptoms that we're treating as well. But I can defer to the member opposite and have additional discussions after the next question.
Thank you, Mr. Chair. The minister didn't answer my question, but I understand he is listing off a lot of things, but we really don't have a lot of time left in the day. So hopefully we can move quickly through some of these answers, because I do have questions that I think it's important to get answers for the people of New Brunswick. So let's move on. I would like to know how much is paid to Medavie health services in this budget?
Thank you very much. And no offense was intended in my answer to the last question. I can check answered, but I heard when is mental health and addiction services going to be free in the province of New Brunswick? That's what I heard. If that's not what the question was, I apologize. So I'm going to ask for clarification on this question, because I don't want to give an answer that's not what was intended by the question, because there's a significant, different numbers that would answer that question depending on what was the intent. So if I could have clarification, if this is the services for extramural or extramural and ambulance or just ambulance, or is it the drug plans that the province, which is flow through, and so they all would have a different number, or is it just the administration from those plans? So just asking for patience and understanding, trying to get the exact question right so we can give as appropriate and accurate a question or an answer as we can.
Thank you, Mr. Chair. I would like to know for Ambulance New Brunswick, extramural, any of the programs that Medavie Health Services is running, excluding the drug plans.
Mr. Chair, I apologize again for the delay. We're trying to, again, get that number, and I know the member opposite has a number of other questions as well. So can I take that under advisement? I will have staff do that calculation, as it's not separated out at this point in time, but it is a number that we can provide, and we can move on to other questions.
Thank you, through the chair, to the minister. Yes, let's do that, and you can bring that number back to the committee. Thank you. So, and I guess this might be a number you have, and if not, maybe your staff can look into it now. I'm wondering how much is being paid to Medavie Health Services in terms of managing NB HealthLink, and I guess another way to ask it is how much does NB HealthLink cost? And I would ask if the minister could table the contract for NB HealthLink.
Thank you very much. So HealthLink, and again, if I've misunderstood the question or there's a nuance that I'm not catching, we have a budget amount on a monthly basis for NB HealthLink of $30,000.
Thank you to the minister. I also wonder if he could respond about tabling the contract. How many employees does NB HealthLink have?
Through you to members opposite, this is a third-party contract, so we don't have the day-to-day numbers of how many employees they would have. Plus the doctors that they hire or NPs that they hire are contract. So so that may not, be the number that the member opposite is looking for. But because that is a separate contract that changes on a day-to-day basis, we don't have a specific number that we can give. It would be incorrect.
Thank you to the minister through the chair. So I don't think I'm alone in finding it a little tricky to understand exactly how this new system is working. I know that I've had many constituents who've sort of bounced around, had trouble navigating this new system. I'm wondering, so you're saying $30,000 a month, and so to be clear, that's to Medavie Health Services, if you could confirm. And then it seems that there are like Medavie clinics popping up that will be where these patients can go to see the doctors. Can you confirm who owns or pays for those spaces?
Okay, thank you very much. And, you know, part of the reason this is a little complicated is, again, for some of that accounting purposes. But if there's a facility that is vacant, is surplus, let's say the hospital up in Dalhousie, St. Joseph's, there was space there. So that space was renovated. That's a government asset. It was considered surplus, so HealthLink went in there. If there's not a government asset, so that's sort of the first line of that's the first option that HealthLink is looking at, or should I say EMA and B, who manage that HealthLink, and that 30,000 is a separate contract for separate types of services. So again, going down to the management side of things, where EMA and B will, EMA and B, I once called it ANBL, which is not correct. Just an aside. So if there's a facility, for instance, we were up on Regent Street, that was a private building, so they would lease that space. Same thing in Moncton. That mall, is leased space. So again, trying to understand the question, if I've heard it right, a lot of these offices, a lot of these facilities are, privately owned and leased from those owners. That's in absence of a surplus space that's acceptable to HealthLink. And some of them are co-located. The clinics are co-located with some of the employed offices as well. So extramural offices. So there's a synergy that occurs there in order to make sure that the value is maximized and the space is maximized as well.
To the minister through the chair. So if the minister could explain briefly, I heard him say, oh, the 30,000 is for something else. So it seems like there's two things going on. So if he could briefly explain what that is, and if he could let us know, are the doctors or nurse practitioners or receptionists or any of the employees employed by Medavie Health Services? Thank you.
Thank you. And once again, just trying to fully understand the question and have a good response, because, you know, we talk about the doctors that are on contract. Well, they're contractors, they're not employees. We talk about some of the clinical staff where, you know, the input, and again, there's also the management from Medavie. So ANBL, Extramural, Ambulance New Brunswick is involved. But specific to the question of Medavie, they also have employees as well. So there's a number of different, and that goes back to the management, you know, who's managing this HealthLink. And that, again, I think is where the member opposite is going to, is where's the money going and is it accountable? The contracts are all negotiated, so it's not just a blank check, and they're negotiated very, very hard. We just went through a negotiation with e-visit MB, and that was an interesting negotiation, and again, I think we ended up at a reasonable spot, but it wasn't without the provider pushing back to say, well, this is not, based on the service I'm providing. I'm hard done by, but again, that's trying to get the best value for the service that needs to be provided. And some of these services are provided by third-party contracts. And that's very similar to negotiating with the physicians. And that's done through New Brunswick Medical Society. So just trying to paint the picture that these contractual arrangements, sometimes they're difficult and cumbersome to fully understand, because there's the management side of things and then the clinical side and then contract work.
Thank you, Mr. Chair. So to the Minister, I don't know that you answered my question. I don't know that it's clearer now than before. So at the Medavie Clinic in Fredericton, for example, who would the receptionist have been hired by? Like, the employee of Medavie Health Services, EMANB, or not? I guess I'm trying to figure out the structure of this, and it feels quite opaque, and it feels like the answers are not helping to make things more clear.
Thank you very much. The example that was used by the member across the floor of a clerk or receptionist would be an employee of EMANB. And when we talk about Medavie clinics, there's no Medavie clinics. They're HealthLink clinics. Anyways, I know it's late in the day, and it might be a little confusing, but again, that's all part of that, the management group, and then the clinical side of it too, which I think is maybe causing some of the confusion.
Thank you to the Minister through the Chair. But to be clear, Medavie Health Services is helping to, they're being paid to manage this. And yes, there may be a contract through Extramural and Ambulance New Brunswick, because they're also managed by Medical Health Service, Medavie Health Services. But like if you go to try to make a complaint, then it points you, like their logos are right beside each other on the website. So all that to say, with so few minutes left and so many questions left, I'm going to have to make some tough decisions here. I guess I'm wondering if the minister said that the receptionist was, for example, would be a staff member of Medavie Health, or of Extramural Ambulance New Brunswick. And so this might just be a yes or no question. Does the minister know how many employees they have?
No.
Okay, thank you. And so for the leased spaces, would it be the government of New Brunswick or Medavie or Extramural or Ambulance New Brunswick who is leasing these spaces?
EMA and B.
Thank you, Minister, through the chair. And are there key performance indicators in place that can provide like a bonus to, I guess, EMA&B, Medavie Health Services, I don't know, for meeting certain KPI, key performance indicators?
Chair, through you, no.
We're on a roll here. So, okay, so I'm going to move on with my precious few minutes that are left. I want to ask, so New Brunswick's had a very high positivity rate for COVID, for PCR tests, and the highest death rate in the country recently. And so I'd like to ask, what is public health and the Minister of Health doing to address this issue?
Chair, through you, and again, just trying to be as accurate as possible on the answer, because it is sort of two different scenarios or two different, I guess, streams of thinking when it comes to testing. I mean, back March of 2022, there was about 8,000 self-referrals for PCR tests. And in February of this year, that number was down to about 370 self-referrals. So the demand has dropped off significantly, and that's why we've changed the way tests are administered. Now, if you're a high risk or one of the people that are at most at risk of COVID, they can still get a test through their referral from their primary caregiver. And but the fact of the matter is there are fewer and fewer people getting the test, and some people I know who have had COVID didn't even bother to report it. So some of that reporting really is not related to the number of deaths. And that's a different question because of the, again, some of the way, you know, they're not really related because, again, part of the problem with people passing away are some of the extenuating situation or the comorbidity or the age or the unvaccinated. There's a number of things that are probably more related to those deaths than the testing out in the market. The other good thing or the other opportunity of reducing some of those stand-up, pop-up test sites that popped up during COVID is that the staff that was assigned to those individual test sites can now be redeployed into the RHAs. Now, some were retired folks that came out of retirement, which we certainly appreciate, but that in itself, that testing is something that, again, we feel that those that are in need of the testing can have access to the testing, but the deaths are something unrelated specifically to that testing. So sort of two things going on there. I'm getting a note. And rapid tests are still okay to use, and so is some of the preventative medicine that, again, at an early stage can address some of those symptoms. So again, just trying to, you know, give as concise an answer to an item that through you, Chair. Sorry.
Thank you to the Minister through the Chair. This may be my last question, and so I'll take the chance to say thank you to the Minister and his staff. But through you, Mr. Chair, to the Minister, when we look at the Canadian COVID forecast, COVID-19 Resources Canada, Dr. Tara Moriarty's lab, they are comparing the different provinces, what's happening, and categorizing New Brunswick as severe, and about 1 in every 24 people as currently infected. So can the Minister respond to that and address how they're going to address the situation and keep New Brunswickers, I guess, protected as much as possible, but addressing this issue in our communities? Thank you.
Thank you very much, Mr. Speaker. And I know sometimes those interjurisdictional comparisons are problematic just because of some of the methodology and some of the information. And I mean, you can look at some of the issues here in New Brunswick that we face of our aging population and population that's, again, faced with some of the challenge that aging brings. And I know going back to the reporting of some of the deaths, for example, in COVID, and what other jurisdictions are using to justify, you know, did a patient die from COVID? Did a patient die with COVID? And how soon after they had COVID did that individual die or pass away? So looking at some of those stats it's always interesting because there's the methodology, there's some of those extenuating circumstances, there's some of those reporting anomalies between jurisdictions that's also very, very kind of difficult to say, well, right from BC to Newfoundland, it's exactly the same, because even that reporting time frame where an individual passed away after they or they were the test, you know, if it happened within 40 days or 30 days or more, it was deemed a death from COVID. So not having that whole area of you know, methodology locked down tight, and with some of those extenuating services, that is some of the things that we really need to look on. But I tell you this, we are aware of that report. We're concerned when we see something like that, and we have asked for additional methodology on an input on that exercise, and we haven't received that yet. So it's kind of, we challenged them and said, well, what's your methodology on this? And we haven't had a response back yet. So taking that information, we saw it, we were concerned about it, went back to the author of that information, and we have yet to hear back on their methodology, because that's an important point to take in consider when you look at that. Just in the moments I have left, or we have left, I see